Hi, and welcome to the Family Justice Center. My name is Dr. Anthony Walls. I am the medical director and primary care physician for Healthcare for Justice.
And my name is Gina I am a forensic nurse examiner. So I work closely with Dr. Walls with Healthcare for Justice. I serve as a board advisory member, and then also I am a forensic nurse here through the Safe Harbor program.
And our purpose today is to give you a short guided tour of the facility. This facility, the Family Justice Center, was opened 2019, in the fall of 2019, and it is a one facility area where the organizations and aftercare providers that provide services for victims and survivors of both human trafficking and domestic violence are all under one roof to be able to provide that care.
Yes. So we are really excited, to have a one-stop facility for people that come through that are interested in the services. So we're excited to tell everyone about them.
So this is the entrance. This is the main entrance waiting room that somebody would come into. Here they would not only register in order to talk to a victim advocate, to learn about all of the different, and there's I believe 25 aftercare agencies that are able to provide aftercare services. Anything from healthcare, primary healthcare, to, in regards to Healthcare for Justice, to case management, public health nursing, helping with childcare resources, just everything somebody would need in order to help rebuild their life in one place.
And some of the resources that we have also help family members or people close to that survivor as well. What
I really like, though, about walking into the waiting room is the feeling. The feeling is that I get, and it's purposefully been curated, if you will, with the choices of furniture, is a feeling of comfort, and it's not a sterile clinic feel.
Right.
And I think that's super important for people who are seeking service to feel comfortable.
Yes. So you'll notice when you first walk in that the ceiling, for instance, is painted as a sky. And so that was inspired by one of our survivors that had received services through our program.
Yeah, and so everything was definitely intentional, but even survivor-led, which is really great. Really great.
Yes.
So after registering, then a client or patient would have the ability to come and talk with a victim advocate in an intake room. Mm-hmm. It sounds formal, but it looks so much different. So why don't we head over there and we can check it out. So this hallway is filled with a few different, or a few rooms, all the same, but they're used for what we call navigation. If you don't mind explaining a little bit about what navigation is.
Sure. So navigation is when the person seeking the services is brought into this area, and they can actually spend quite a bit of time in here. We bring the services that we offer, like Dr. Walls had said, the 25 different agencies that provide services here to the person, instead of having that person have to seek out those services on their own. So while they're sitting in here, we have just as much of a comfortable environment: couches, chairs, snacks, with coffee, and we try and really make it a welcoming environment so the person is comfortable.
And one thing that, Gina, I always appreciate you pointing out is from the beginning, walking through the door, through, in my opinion, the end of the visit, everything is purposefully designed to be trauma-informed in the care that we provide. And part of that is, if somebody doesn't want any of the services, that's okay.
Yes.
If they want only one, that's okay. If they want all 25, that's okay.
Yes. Yeah, our purpose is to inform the survivor what services are out there and what they feel comfortable taking a part of. And if they choose not to take a part of those services, that's okay. We're okay with that. But we want to just make sure that they're available.
And so after the navigation process, and they were wanting to see us in clinic, we would then meet with them in our clinic space. So why don't we head down the hall and we'll go down to the clinic space. So this is one of the two clinic space or clinic rooms that we have here at the Family Justice Center. This one is technically designated for Healthcare for Justice, but what has been so amazing to be under one roof with so many aftercare organizations, but especially the Sexual Assault Nurse Examining Program, is that we are able to work together, and Healthcare for Justice benefits immensely by having wonderful nursing available to help with patient care.
And I think that goes for both the forensic exam program as well as Healthcare for Justice, because when somebody does come in to see a forensic nurse to have an examination, Healthcare for Justice and the forensic program can work very closely together to ensure that that person, if needed, has that continuity of care and that follow-up medical care that they need, since the forensic exams are a very acute situation and not a healthcare program.
Like a primary care
Like a primary
program.
care.
Yeah,
right.
yeah, it's been a wonderful partnership. And so we have everything we need in our clinic space to provide a full spectrum primary health care. So let's finish out the tour and let's look at the rest of the clinic.
All right.
After you. And rounding out our tour, we wanted to highlight our family waiting room. Also, again, something that a lot of thought went into because a lot of our patients and clients, they have children. So it's a nice, comfortable, relaxing area with a kid's table, a place to color, and also for other adults to hang out. And usually they like it because they get to get on their phone.
Yes, it gives them time. And like Dr. Wall said, we worked really hard to make sure that it was a welcoming environment. And so if a support person was to come with the person, then they have that comfortable place to wait, during this process.
And then sometimes we have patients that are just rightly so terrified to come in through a main entrance and talk to somebody at a desk in order to register. I mean, there's so many trigger words for a lot of people who've been traumatized there that it will prevent them from coming. And so what's amazing about the Family Justice Center and what the administration of the Family Justice Center has allowed us to do, both Safe Harbor and Healthcare for Justice, is have another entrance.
Right. So like we said before, not everybody chooses to take advantage of the services that are being offered, and we understand that and we're okay with that. So if the person chooses not to use that front entrance, we actually have another entrance for them to use, and then they can be brought right into this family waiting room or into the exam room. And that's something that Dr. Walls will always make sure to cover with the person and talk to the person and see where their comfort level is, and we will always be willing to work with them.
Well, that said, thank you so much for joining us, not only on this tour, but in this mission. And we're just grateful to be able to be here. We owe so much to the DA's office and getting this grant, the grant in order to provide this infrastructure that lets us provide the care that is so needed by this patient population. So thank you to the Family Justice Center, and welcome.
Yes, we definitely, are being able to serve the people that we have a passion to help and to provide these services to. So like Dr. Wall said, we're so excited that we have this one place to perform all of these services, and we're very grateful.